Good day, this is Professor Will, CBMD PhD. Today is Wednesday, November 17, 2021. It is 2:55 and 20 seconds p.m. Eastern Standard Time. Today's research, blood pressure control. So let's hop to it here. Precise blood pressure control may aid patient recovery from spinal injury. A study using machine learning techniques suggests that maintaining an optimal range of blood pressure control during surgical repair of spinal injuries may improve patient outcomes. Date November 16, 2021. Source, eLife. Current guidelines for treating patients with spinal cord injuries recommend avoiding low blood pressure, ensuring the adequate flow of blood to the injury site to allow recovery. But blood pressure that is too high can cause bleeding in the spinal cord that can add to the damage. The precise window for optimal blood pressure management to promote recovery from acute spinal cord injury is poorly understood. Researchers set out to apply machine learning analytics to blood pressure and heart rate changes in operating rooms. The idea was to test the associations between these factors during surgery and neural recovery to determine treatment thresholds that forecast recovery. The research team analyzed blood pressure data from 118 patients who underwent surgery for spinal cord injuries. The researchers found that patients with blood pressure that was either too high or too low during surgery for an acute spinal cord injury had poorer neuromotor recovery after surgery. The researchers also found that patients had the best chance at recovery if their mean blood pressure was maintained between 76 mmHg and 104 to 117 mmHg. The results suggest that more precise upper and lower blood pressure targets may help physicians maximize their patients' odds of recovery after a spinal cord injury. Although these findings need to be confirmed by other studies, but if they are, they could lead to more use of machine learning tools to guide the care of patients with spinal cord injuries. Good day, this is Professor Will, CBMD PhD, on microbiology, bioinformatics, and pathophysiology. This video was created for educational purposes only. Hope you enjoyed listening. Until next time, have a great day.